Government, a very dynamic
number one and nothing.
Comrade Akbar Tainero way behind things. That's the champion himself. Champion of project. Champion of human capital development. Champion of respect for the traditional institution. Champion for respect.
No vaccine will be approved for use if it has not been declared safe by the respective authority at the various levels. WHO will not fund public acceptance of vaccine if the vaccine is not safe. UNICEF and other UN agencies will not put their efforts into ensuring that vaccines that are not safe goes into the community. One of the issues we are yet to understand is the vaccines we think are new to us in Nigeria. They are not new. They are only new to us because it has become publicly available. And that is why you say it's new. For example, HPV vaccine is not new. And for some of us here who are of age, you would have testified that before the HPV vaccine was introduced last year, some of our girl children already took it. They bought it in private facilities, have you? They paid 40-something thousand, 70-something thousand. Then was it new? Was it fake? Then why is it becoming fake? Because it is now available for every kind of person to access it. It is because there is a deliberate effort to ensure that whatever the common man can get should be frustrated. That is one of the reasons. And that's why all of this media publicity against these vaccines are high. Rotavirus vaccine is not new, though it was introduced about 4 years ago. I was with a local government chairman. Twice I've had advocacy to that local government chairman. And one thing he has always said whenever I wanted to respond is to thank the agencies and the partners for making rotavirus vaccine available to the common man. Because he testified with his mouth that when he was giving birth to his own children in Asaba, and they wanted to give this rotavirus vaccine to the children, it is not the money they are paying that was of pain to him. They were the people publicizing the rotavirus virus. What they will do is, because in a bottle of that vaccine, you have about 10 doses. That means 10 children are supposed to have that vaccine taken. So what will they do? If you give birth to a child, you will begin to look for your friends whose children, so that you will tell them that more will go to this hospital. Then when they are about 5, the hospital will now agree to open the bottle. Then they will now pay for the 10 people that will take that vaccine. Their 5 children will take it. But once it became available for the common man to have it, it became fake. HPV vaccine that we are sharing today is not new. The fight against polio started right from 1986. And that was when the fight against polio started, after the World Health Congress, when the United Nations and governments of the nation decided that let's go against polio. And as of today, there are only 2 nations of the world still having the white polio virus, Pakistan and Afghanistan. And the reason is simple. They are war-torn zones. Public health efforts are not yielding the needed results. As of 2016, sir, the last case of white polio virus was discovered in Nigeria. After 5 years, Nigeria was declared polio-free from the white polio virus. It is down to the effort of what? Vaccine. The efficacy of vaccine, the potency of vaccine in preventing and curbing public health diseases cannot be overemphasized. If we have issues about it, sir, don't listen to the market women. Don't listen to what is flying in the media. Locate a well-known medical doctor. Go to our PHCs. Go to the government hospital. Look for a doctor that is specialized in that area. Ask if this thing is real. If it is market women you want to ask, they will tell you the price of tomatoes. If it is vaccine, ask us. You will get the right answer. WHO is a technical partner supporting health activity across the world. Before now, we used to think WHO is in Geneva, or WHO is in Abuja,
but the WHO is in Asaba. But the reality of it is we are close to the community than ever before. And the reason is simply because when it concerns health, it starts from the community and builds up. Therefore, if we must attain universal health coverage as expected, the effort will also begin from the community, from the lowest level, wherever the people are found, whether on land, water, inside the cave, wherever people live. The goal is to ensure that wherever people live, they are able to attain universal health coverage. And the effort to attain universal health coverage begins with prevention. It begins with doing what we can do to ensure that we are protected from diseases. And there are two groups of persons that are more prone to coming down with any kind of disease, and sometimes they are also the likely persons to become casualty when it comes to deaths from diseases. They are the young and the elderly. And that is why efforts to preventing disease begin from when the child is not born. Right from the time the child is still in the womb of the mother, prevention against disease begins. And that is why when you have a wife, a brother, a sister who goes to the hospital for antenatal care, they give them what we know as TD, tetanus injection. It is to protect that unborn child against a specific disease known as neonatal tetanus. And by the time the child is born, right from the very first day the child is born, we begin to apply vaccines to that child, beginning from the BCG and the rest. And the effort to ensure that every child is protected does not end with those vaccines. And that is why at routine time, we carry out what we know as Obaro or NIPD, which is what we are currently doing now, the National Immunization Plus Days. And that is why this meeting is of essence to us. Because in ensuring that every child is immunized, the only place you see the child, they are within the community. They are either at home, in school, in marketplaces, in motor park, in the mosque, wherever. And that is where our people have been going through. For this year, this is the second round of this exercise. And at this point, I must sincerely appreciate the chairman for being so committed. The first time we met with him was barely 2 weeks ago. And we were able to provide him with a few reports of the last round that held in the month of April/May. And what is expected of him and the FJ. And all this we are seeing today, they are part of the effort he has made. This morning he has been with us. He was with us in one of the schools this morning where he did immunization. He has been with us for the past 2 days during our AMI review meeting. This is not a praise to you, sir. I'm just testifying that you have responded to the demand that the heads of the children have placed on you and on the local government. However, we found out that when we are doing this type of activities, though it's not peculiar to Warri South, but the LG have decided to take a shot on more effort to ensure that it's no more a challenge. And what is the challenge? Our people meeting children and parents, schools, churches, mosques, rejecting the vaccine for their children. That is the reason why we are here. I want to discuss the issue around all of this. Why are people doing this? What is the right thing to do? How do we go around about it? How can you be of support to ensure it? For us, we can only say that immunization has taken place if every eligible child has received the vaccine. If one eligible child is found not to have received the vaccine, then it has not taken place. How can we ensure that every child who is eligible for this vaccine gets this vaccine? What role can you play? What role can I play? What role can every one of us here play to ensure that our children are immunized? That is why we are here. No other reason. And as a technical partner, we are here to provide our support, whichever way we can. Once again, thank you very much to the LGA chairman and his executive. and to every one of us here. You are welcome. Thank you. God bless you.
Primary Health Care Development Agency, Delta State, Dr. Paul Inquiry. I want to thank our chairman for putting this together. This is so impressive. We are really very, very grateful. In the agency, we have a department called Social Mobilization and Advocacy Unit. Last week, we had a meeting with all the traditional rulers in Delta State. We had a meeting where we invited CAN, PFN, Leagues of Imam, Pediatric Association of Nigeria, all the partners that we feel are involved in this exercise. The guy from the WHO has spoken what this exercise is all about. I'm not going to go back to that. But when this exercise is done, we don't sit in the office. This is one office where most times you get out, we don't even have to sit down because our job is in the field. We go to people at Ayakromo, people at all the field, Toroben, all those places now. Inside the boat, going to make sure that people are immunized. People go to Omagino, all those areas, just to be sure that our children are protected. This vaccine, the oral polio vaccine, is given to children between the ages of 0 to 59 months. That is 0 to 5 years. And the essence is to prevent what we call vaccine preventable diseases. There are many of them. Polio, diphtheria, tetanus. Just mention them, there are many. That if you give them to this child, by the grace of God, even when there is an outbreak, the vaccine is an antigen. It builds the child immunity. They say one with God is majority. When you give this vaccine, it's like empowering somebody. Even when the vaccine comes, you remember when we had COVID-19, those who had strong immunity, even when they had contact with those that had the virus, they were not down. So that's why we give it to children. There's also the one we give to children. Girls child of between 9 to 14 years, the one they call the HPV. You've heard of human papillomavirus. That children, if you see, before I went to Asaba, I was a director of school services at the teaching hospital in Ovwighose. Before I was at all, there was a girl that I saw there in the ward. The whole of the vagina was gone with this disease. And we just think it's just a play. It's not a shy thing. We are all in the health field. We see these things every day. I served in the north, in Sokoto State, when I was doing my youth service, and you see children with polio. It's very common there than here. There was a time that we were almost, I think as of today we have about, WHO, I can remember the statistics, about 12% now, or thereabout. There was a time we were almost 0%. But because of these issues of people not wanting to, don't forget that 2 weeks ago we had an outbreak of diphtheria in Delta State here. People brought it from somewhere. COVID-19 started in Wuhan, China, somewhere in China, but they came to Nigeria. So if all of us are saying, and there was a church we went to the first round, and the pastor, with all due respect to our Christian brothers, said the Holy Spirit ministered to him that we should not give the vaccine. I felt so bad that, how will somebody, that's blasphemy. How can you say the Holy Spirit said you should not give children vaccine? And if your child is sick, you will take him to the best hospital in Lagos and Abuja. So the reason why, Chairman, thank you so much. The reason why we have called this meeting is so that we can go back. I'm sure all of us here will represent one unit or the other. This morning we were at First Baptist Church Primary School, and the headmaster there was telling us that we cannot immunize the children because they've not gotten confirmation from the parents. And I asked her, did you get letter from CAN, from school proprietor? I said yes. She showed me that she put it on the platform of the parents. Nobody responded. I said, but you know what? In law, they say silence is what? Consent. So if they kept quiet, did not respond, that means they've agreed. Please give them. He refused, and I called the honorable commissioner. And the commissioner said, okay, fine, you know what? Give this man a letter to say that you have rejected this vaccine. Out of that fear, he allowed us to immunize the children. But how long are we going to be doing that? So Some churches have been cooperating. Yesterday we were at Word of Life Bible Church, and I really commend that church. We met more than 600 children in that church yesterday. The Celestial Church at Ajamoga, they came out in full force. So, but some churches will just, Christ Embassy, I don't know if they are here, it's also one church that I want to appeal to. You see, we don't jeopardize the life of these children because of our different beliefs. And I told them in Asaba when we had meeting with one of the group, I said there are too many beliefs. Somebody will tell you that, oh, if you give this thing to a person, it will affect the chance of having children. If you give this to this person, the person will not grow. When we were to take the COVID vaccine, somebody said if you take it, it will do one thing. And I took the 3 doses. I'm still here standing very strong. So we want to appeal to all of us seated here that because we represent one group or the other, and that's why Chairman has said to do this, it is part of what we do in Asaba, the social mobilization advocacy unit, to go back and talk to our people in our churches, in our mosque. I saw the Muslim community here. Thank you for coming. Please. It was more common in the north, but let's go back and talk to our people. After we have this program Saturday, Sunday, Monday, Tuesday, the first 4 days. Wednesday and Thursday we are doing mop-up. Eventually, before we left the Baptist church this morning, only 7 that we could not immunize because I told the team, I said, make sure tomorrow morning, I'm still in Warri, we will go back and make sure those children are immunized for the future of the life of these children. So that is why we are here. So let us go back and talk to the various groups. There are so many faces I know here that I've met before. I grew up in this Warri. Please, Ekurede Shekeri, Akbasa, Bori, Ejeba, those places, let's go back and talk to our people. The vaccine, one other thing that I'm right, the vaccine is very safe. Now, oral vaccine now, you will talk about the children amount. Even the one you inject, they do anything. They cause anything. Anybody tell you, say, if you give the vaccine, it go make you not born picking tomorrow. Tell the person a lie. Or if you take them, it will make you not grow. Na lie. These are all fallacy. These are all stories that are not correct. So once again, on behalf of my director, executive director, I want to especially thank Chairman Warri local government, sir. Thank you so much for putting this together. We are really very, very grateful. I didn't even know this was coming up. I came in for supervision. When Nina Korai told me that this meeting was holding, I said, I must be here. Thank you for the opportunity given to us to talk to our people. And we believe that this will go a long way to make sure that we sensitize our people. This is something we do routinely. And we also want to thank our partners. WHO, UNICEF, they spend their money. They even put their men on the field to make sure, this thing comes up. What the government provides is what we call counterpart funding. So the bulk of the money comes from the agent. This is what you see. GAVI, Solina, there are so many. Most of these things that we do, they are the ones that provide the money, they provide the vaccines. So if they spend this money and we don't see them, the advantage is very bad. Then they're also giving vitamin A supplements. For the children, we're also giving multivitamin for pregnant women. Those won't happen more in the primary healthcare centers for women that come for routine immunization. Encourage your wife, if she's pregnant, go to the health center and collect these things. It helps the child to develop well. Vitamin A, we know that improves the sight of the children. So these vaccines are very, 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 very safe. Once again, I want to thank you for the opportunity to speak to all of us and thank our chairman and every member of the IT group for this opportunity. Thank you so much, sir. God bless you.
For record's sake, the reason why we decided to invite all of us that are here, that are critical stakeholders in Warri South local government area here, is for us to work together to jointly solve the problem of non-compliance, as it has to do with the application of this immunization in Warri South local government area, because it's obvious to us that only one man cannot do it. And that is why we feel that everybody that we have invited here has a role to play. Because this immunization thing is an ongoing thing. No sooner that this one is ended, another round will come. No sooner that that one is ended, another one will come. And please, sorry. The health officers that goes into our various communities to apply these drugs, they have been coming back to us to complain that when they get there, some of our parents will not make their children available for these drugs to be applied to them. These same drugs, like we all know, is free. Nobody is asked to pay a dime. In the other way around, when we have challenges occasioned by not taking such drugs, we go to various public and private clinics and hospitals to spend huge amount of money. Now this one is free, but we don't want to take it. And the reason why we don't want to take it is that a stranger cannot just come and say, no matter how good that thing is, and say take something. You'll be skeptical. You need to see people around you, people that you know, that can convince you to say, this thing will not cause any harm to you before you will take it. That is the reason why we are here. So apart from that, if there are other reasons why we have not been encouraging our wards to take these drugs, we are going to throw the floor open. Use some time to do some level of interaction to know why, apart from this reason that we have identified, if there are other reasons, let us put them on the table and together find solutions to them. Finally, we believe that if we break all of the geographical units in Warri South into DSEC ward of 20 wards, we are going to have some persons that are here that are councillors in these wards. Some persons that are here, they are parents from these wards. Some persons that are here, they are members of churches from these wards. Some persons that are here are the youth leader, trust chairman of some communities from this wards, and a host of other persons. So it is our thinking that as the health officers go around to apply these drugs, if they meet any resistance, if they are able to call the councillor of that ward, the councillor, if it is a church, the councillor will be able to call first the CAM Warri South chapter chairman. From there, connect to the pastor of the church. From there, connect to the member of the church and encourage the person to take the drugs. Where the person too is not is from a primary school or a secondary school, we can connect to the NUT, and from the NUT to the principal or the headmaster of the school. From there, we can connect to the parents or through the PTA and all of that. So if we properly organize ourselves in the manner in which I have just illustrated, we are very well convinced that those things that creates apathy for people not want to make their children available for these drugs will be addressed. So this, in a nutshell, is the summary for which we are here, because we all know that disease is not our friend, it is our enemy. And if you don't treat it, it will deteriorate to a point where we have had stories of how diseases kills. So please, we will throw the floor open in the next section so that we interact and collectively agree on how best to solve the problem. In summary, so this is why we are here. Once again, I want to thank you for finding time to honor our invitation. Thank you.
The second round of immunization, which is ongoing in Warri South, particularly across the nation, but we are particularly to ourselves, Warri South local government. I want to say thank you for the quick and timely intervention for you to come on this platform. I want to say that you're all welcome to this program, and God bless you. Thank you.
Fine for us to get sound refutes from technical personnel about the fears of the people. People are afraid to take these vaccines. We will not just wave aside the stories that we hear. Every information, whether it is correct or not correct, there's an element, they say, of truth in certain information that are rumored. So when we gather like this, we want to get technical personnel giving us, confidence by bringing out information. For example, when you say I should take this vaccine, you are not the one who produced it. These things were produced from outside our country. All right? Now, what verification have been done by doctors in Nigeria to certify that these things are okay? In a forum like this, we want to get those kind of statements so that can give us the confidence to tell people, in a forum like this that was done in one program, I asked how many of our doctors could certify, because they were not produced here in Nigeria. And you see, you cannot love your neighbor more than yourself. Some of these vaccines that are pushed down here, they don't administer them in their own nation, right? And you see, there is a lot of trust deficient on the government. People don't trust government so much because of a lot of betrayal. So as we gather like this, rather than just say go and take it, I need to get information that are technical enough to debunk those, those stories, those rumors that we are hearing on social media about this vaccine. So I want the technical persons that are here to be able to tell us, yes, Nigerian government doctors have looked at this vaccine, and we can tell you this, we can tell you that about this vaccine that is okay. Or not just to say, don't mind them what they are saying. All right? Let us get statistics, information about the authenticity of these vaccines. I think I would like to get such from this forum. Thank you.
My small advice in the first place is that before such programs are done, I know there is this sensitization that is done on television, on the radios. Yes, it is very good. But I think there can be this kind of sensitization at the local levels before the program. So that even before you come, these people would have been aware that something like this is coming, and our people would have been able to address them properly. Nothing will happen. that just for your own good. Not during the program and you have observed that there are some lapses, you now come for stakeholders discussion. So I think going forward, next time, let's do this before that. Then number two, the health personnel that just spoke was giving the panacea for Ebola and Lassa fever. And she talked about washing of hands. But the main thing, the causative agent, was not mentioned now. That is rodents. Without rodents, we won't have such diseases. So our focus in the first place should be how to ensure that rodents or rats, as we all know, is taken care of by taking proper care of our refuse, cleaning the whole place so that we don't have rats. If we don't have rats, we will not need to wash our hands on, because we Nigerians who must shake hands. It is our culture. So these two things I just want to say. Thank you. God bless you.
It's a suggestion I want to make. Sincerely, what we are talking about here is a trust issue thing. People tend to listen to people they know. If these field officers are going to the field to do the immunization, it is proper that they take people from the community with them, so that at least we can tell them that, Papa, Mama, you know me, I be your brother, I be your pikin. Allow these people to do this thing to my brother, to my sister, to my pikin. I think it will go a long way in the parents and the world to accept this immunization. Despite the normal orientation we are going to do, let us allow people they know to follow the field workers to talk to them. That is my contribution. Thank you.
The chairman of Presbyterian community. So what I want to say, I want to talk about the fears. I want to use myself as an example. For some time ago, when I was working at Tesco, there is this varicella virus, that is chickenpox. One of my friends caught the virus, so they took everybody to the hospital, to the clinic. That since that guy got that varicella virus, it had affected the rest of us. So when we went there, when they did the proper checkup on us, I was not affected. Then they asked why. Then I told them I've already been vaccinated some time ago. So all of them, they got the chickenpox, but the chickenpox did not affect me up to date, because my parents took me to go and take the vaccine. So only that one alone made me to understand that these vaccines, they are real. So I always take my children to go and get them vaccinated. So I want to urge all of us here that those vaccines we are seeing, they are real. They will do us more good than harm. What about the tetanus injection that we used to take? When you take the tetanus injection, if you have cut or those rust nails shook your leg, even if you do not take any tablets, when the time comes, only with the injury will just heal. So I want to urge all of us to take the vaccine, because it will do us more good. Thank you all.